when we talk about ketogenic diets and carnivore diets, naturally that sort of evolves or goes down the path to talk about blood sugar levels. And we talk about type 2 diabetics. We don't hear about type 1 diabetics all that often. Have you seen any success with any patients treating type 1 diabetes with this approach?
Oh, absolutely. Absolutely. I mean, there have been a few oddball cases of people claiming that they've come off insulin as type 1s, and that's highly obviously controversial and questionable. However, what I clearly see is insulin requirements drop dramatically. You get somebody who's regularly taking 100, 150 units, and now they're down to 30 a day or something like that. They're taking a little basal and a little bit, obviously there's different ways to, dose type 1s now, whether they're on a pump or something like that. But the amount of insulin that they use generally dramatically drops 50%, 75%, something like that. Their control is so much better. They don't have these fluctuations, these up and downs. They have less hypos, which is, one of the concerns because their blood glucose is so stabilized. And, a guy named Richard Bernstein, who wrote a book called The Diabetes Solution, talked about the law of small numbers. And so instead of having to inject 20 units after a meal, of regular insulin or fast acting insulin, they may have to give themselves 2 or 3 units. And so the blood glucose just kind of does that instead of that.
That's right.
But more importantly, not just the glycemic control, which I think is important, but we are seeing, and I have seen a number of people who have reversed their diabetic retinopathy. They go to the eye doctor and their retinas look better. We've seen people improve their renal function. So people that have, maybe early stage 1, chronic kidney disease, now they don't. They lose weight, they feel better, they get all the other benefits that people have. So for a type 1 diabetic, I think this should be certainly a low carb, ketogenic, and even a carnivore diet are, again, I think that should be the first line therapy, honestly. And I've gotten, and again, obviously 95% of diabetics these days are type 2s, but among the 5% of diabetics that are type 1s, I've seen hundreds do carnivore diets and do tremendously well.
Now, the reason why I said selfishly is because I'm type 1 diabetic, and I just want to put it out there for any type 1 diabetics listening. So I've been doing 1 meal a day since about 2006 or 7. And that 1 meal a day has slowly evolved into being a ketogenic or as much of a carnivore diet as possible. And so I can attest to what you're saying is the law of small numbers and the ups and downs. You don't want to chase that roller coaster. And so if I had my phone, I don't have my phone on me, I would show you a real-time graph of there's no ups and downs. It's pretty stable. And the A1C would reflect that. So I would urge type 1 diabetics to approach it with caution, because at first it can be difficult. You might have some lows, but give it a shot because I myself, the amount of insulin that I take has cut back 95%. Sometimes I don't even inject at all in a couple of days straight, so selfish, but I wanted to put it out there because I think it's important. What are your thoughts on ketogenic metabolic therapy or reducing carbs to help treat cancer? There's a lot of data that's showing that in particular types of cancer, glioblastoma in particular, can be very effective.
Let me just as a transition to that, we know that, for instance, type 1 diabetics that inject, I think it's over 0.8 units per kilogram, double the risk for cancer. So if you weigh 100 kilos and you inject more than 80 units a day, your risk for cancer is double compared to those that inject less than 50. So that's interesting to know. So when we keep our insulin in check, either endogenously or exogenously, our cancer rates go down. Now, you're absolutely right that, guys like Thomas Seyfried and others have, I look at the group out of Hungary, the Paleomedicina group has been treating cancer with ketogenic, Paleolithic, basically carnivore diets, high-fat carnivore diets for a better part of a decade. So, there was a recent published study on glioblastoma. I believe it was GBM, and they showed that I think they had 18 patients in the trial. I want to say 12 of them pursued a ketogenic diet. The other 6 did not. They followed them over 5 years. Of the 12, I think 3/4 of them made it past 3 years that were on a ketogenic diet, and only 1 in the non-ketogenic diet lasted to 3 years. So that was like an 83% improvement in survival rate just by a ketogenic diet. And, obviously people talk about the Warburg effect, where we go back to Otto Warburg from his research from the 1920s and 30s and 40s. Interesting book on him called Ravenous, which a friend of mine wrote, which I thought was quite interesting. Otto Warburg is a gay Jewish guy during World War II Nazi times, and they kept him alive. Hitler kept him alive because he was doing critical cancer research. But it seems to be that there is some benefit to increasing, what's called the GKI, the glucose ketone index, to lower your glucose, increase your ketones, and it seems to facilitate prolonged life. Decrease the likelihood of metastatic disease. And in some cases, we've seen regression. I've anecdotally talked to patients. Again, this is anecdotal, so you can't necessarily, you don't want to discount it, but you can't say it's super solid science. So I do think there's benefits. I've talked to a number of patients that have gone through cancer treatment, particularly chemotherapy, and they've done a carnivore diet. And what they have noticed and what their physicians seem to confirm is that they have basically almost no side effects. I mean, they sort of blow through this very, very nicely. So at the very least, it should be considered as a beneficial adjuvant, to any kind of therapy out there. I'm not saying you should just forego all normal cancer treatment and just do a ketogenic diet. There are some people that would say that the outcomes are better, but I'm not an oncologist. That's not my wheelhouse, but I can tell you, I've seen a lot of people with cancer, either improve their survivability. It maybe getting an extra 2 or 3 years versus a few months with this. So I think there's something there for sure.
Beneficial adjuvant. I like that. That's a nice way to put it. And glioblastoma in particular is interesting because there has been no improvement in treatment outcomes or just outcomes in general with new treatments over the last 80 years. It's been the same until you look at what Siegfried and Tomasz Dudaj, who was one of his postdocs that I spoke to about this, they've been doing that. And so they're the ones that put that work out there. Very, very interesting.